The World Health Organization recently declared the outbreak of monkeypox as a public health emergency of international concern. What exactly is this disease and how can it be prevented? Good evening, welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. Today we are looking at monkeypox, also known as mpox. Stay tuned, the conversation begins after this break. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Folake Kofo-Idowu. She is an infectious disease expert and she is going to tell us what exactly is monkeypox. Good evening, Folake Kofo-Idowu, and thanks for joining us.
Good evening, Ms. Omomi.
All right, I am Olasumbo Modupe. Thank you so much, Dr. Folake Kofo-Idowu, for joining us on the program. Tell us, the World Health Organization recently declared monkeypox as a public health emergency of international concern. How is this a concern?
Thank you very much for having me. So, the declaration of a global emergency is because the disease has now been detected and is spreading through areas where it is not normally seen. Mpox, as it's known, has been sort of cordoned to areas where we know it is. It's just like saying you know where malaria is. It's been in certain parts of the world, but it's not been spreading, and whatever efforts has been done to try to curtail that. But unfortunately now, because we had an outbreak in 2022, and now they're seeing variants in European countries, and it's beginning to spread, and that's why it's now a global emergency, because it's something you would normally not find in that area, and the rate of spread is really, really fast.
All right, why is it called monkeypox? Is the disease spread by monkeys? Let me ask, because I'm sure that is what viewers are also curious about.
I think it was because originally they suspected that humans contacted it from primates. And that was why, and that was somewhere in the 1950s. So that was why it was named after that. After that, it was named monkeypox because of that. And then they also did find traces of that in monkeys in those areas where they first detected it in humans.
Okay, what do you know about this disease? Are there cases already in Nigeria?
We have. So monkeypox has, or mpox as it's called now, has two clades, kind of like two variants. And there's one variant that's known to be in West Africa, and there's another that's been known that is or has been in East Africa, which is the Congo area. And now, yes, so we've had, just like in 2022 when there was an outbreak, there were some cases that were detected in Nigeria. But then again, because it's an ongoing, like kind of like under brewing thing. It's not something that really makes the news. We've had it, we just don't have a lot of it or large numbers of it, and it's not necessarily spreading. So that's, I guess, so basically that answers the question, do we have it here? In terms of what we know about it, it's a viral infection, and it is from the same family as smallpox. And it's so it's a pox virus. That's the simple English name, but it's kind of, I think it's called what is it called? Orthoviridae. So it's a type of virus. It's a family similar to smallpox, and the contacting it or contracting it is unfortunately for this one, it's a wide range of things, a spectrum. So sharing space with someone, just human to human contact, touching or getting in contact with the rash or the secretions from the rash is contagious. Respiratory droplets. So when the person who has it, if they sneeze, they cough, and they don't protect themselves, or you're not protected, you can get it. And also contaminated surfaces. So if someone who has the rash doesn't wash their hands, they touch a doorknob, they touch a bottle of water, someone else touches it, puts it on their skin, boom. So that's why this is, sort of rapidly spreading.
All right.
And it's similar in presentation. We don't know people like me now don't know what smallpox looks like in real life, except in pictures. So the closest people could maybe mentally relate it to is probably chickenpox. But it starts and it looks different from chickenpox. But again, the way it starts, you have like a flat rash. That rash starts to swell, and when it starts to swell or raise, it becomes painful, it becomes itchy, and then from there, that swelling now has clear fluid, which is what chickenpox rash looks like. It looks like a blister, and that blister now the fluid turns into pus, and that pus will rupture and it becomes an open scab. So from the time the person gets infected and their body is brewing it before the rash shows till the last scab heals, that period can last between 5 to 21 days, and people are infectious in that period. And unfortunately, the rash itself lasts about 4 weeks to just everything to crust off. One important thing to also note with the rash for mpox is that it differs from chickenpox in that everything comes at once. Chickenpox, it starts bit by bit, like it comes on this side, then before you know what's happening tomorrow, this one is drying up, then another one comes up. For mpox and also smallpox, everything comes up boom, one time, and all the rashes go through the stage together at the same time. So at least that's kind of good, because you know when it starts, not, oh, this one started, that one started after, and it takes that. Symptoms, people, aside the rash, people could also have what we call systemic symptoms: fever, headache, muscle ache. One thing that differentiates mpox from a lot of the other rash infections that we have is it comes with swollen lymph nodes. So people could feel swelling or maybe some pain in their neck, armpits, groin. Yoruba call it petele, when a kid maybe bumps their knee or they skin their leg and they have like a swelling around their groin. It's a little painful. We call it petele, that's what I remember that as. So you can have that in your neck because we have lymph nodes all around that sieve dirt and things like that prevents it from going into the blood. So there's a reaction there. But interestingly also, presentation can vary. Some people will not have a rash. They may be lucky their immune system is strong enough, able to fight enough that they just feel a little headache, my body is not too well. And some people may not have a lot of systemic symptoms, but they have a rash. Some people's rash may not last long. So it varies. So if you're having anything, and now that it's becoming a problem, if you're having anything suspicious, or know that I'm feeling sick after I came in contact with someone, you want to isolate yourself first, maybe talk to a doctor or call someone, and then they give you specific instructions on how best to go about it. Unfortunately, treatment is We
Okay.
don't have
Before we
specific
look at, before we
treatments
talk
or
about
protocol treatments
Dr.
that,
Kofodo,
yes, ma'am.
before we talk about treatment, let us look at people that are at risk. Sincerely, I don't know what smallpox look like, let alone chicken pox. But is it also similar to measles? Before we look at the risk, who at risk? Who is at risk? Let me put it that way.
It is similar to measles in the sense that it is what we call an exanthem. They are not in the same family, but they are similar, right? They're similar. So these ones are pox viridae. The other one, measles, is in another family, just like varicella, which is what is
Okay.
it called?
Okay, so who is at risk now before we look at treatment, prevention?
So people who are at risk, mostly people with compromised immunity or suppressed immunity. And unfortunately, many times we tend to look at that as people who are obviously very sick, and that's not true. People who have chronic diseases that is not being managed properly. So if you have diabetes and your diabetes is not controlled, you are immunocompromised. Someone who has some other conditions, maybe they have a stroke, they have repeated asthma, you're on steroids, you have things like COPD, you are immune suppressed or immune compromised, or relatively, maybe not very, and that way people like that have a risk, higher risk than the general population. Another part is people with high risk sexual behaviors. So those who have multiple sexual partners, those who have sex with men, usually not through the normal route, are also at risk.
All right, so are there precautionary measures to put in place before we look at treatment?
Yes. So once you know that you're in the area, so one is when if you have a cough, if you have a cold, as much as possible, try to isolate yourself, wear a face mask because this can spread through respiratory means. If you have a rash, obviously you want to cover up, you want to stay away from people so that you're not transmitting. And if there's somebody around, you're around someone who has that, you want to put some separation there. That's one. People who have high risk sexual behaviors probably want to caution themselves, in terms of that, use certain protection. Unfortunately, there's the body fluid part of it, but there's also the skin to skin part of it, because people could get it without a visible rash if they are in the active infectious stage. So it takes a little bit of discernment, but everybody just needs to be cautious. Day-to-day hand washing never goes out of style, because if someone had touched a bottle of water or a doorknob and I go and touch it, so you enter into a place, as much as possible, as frequently as possible, wash your hands with soap and water, at least 20 minutes of proper rubbing and in between, or use hand sanitizers frequently.
All right, what about public health precautionary measures? Because I know the NCDC as well as the World Health Organization have announced some steps in place, but what are we supposed to do as a public, as a community?
So as a community, one of the things that could have been good is if we had the vaccine here in Nigeria. Getting vaccinated would be like the greatest, the best, because again, when you have community immunity, it reduces the risk of transmission, because it's like trying to give me a bottle of water. If I cannot hold it, right, there's limited chances that I can give it to somebody else, and literally that's just so. If I cannot catch it from someone, the chances I'll give it to my household is very, very little. So vaccination would have been the best, and I hope that we would be able to get the Genius vaccine really soon. But again, people who are infected, precaution: don't scratch, wash your hands, isolate yourself, cover up when if you have a cough or respiratory symptoms, and people who are around sick people also, you want to wash your hands, you want to wear face covering around them so that you don't inhale. Beddings and clothes also, it can be transmitted. If you lay on the bed that someone who has active and open rash lays on, you can catch it. So beddings and clothing should be washed, and washed with either very hot, if not just either, with hot water and bleach, so that you can sterilize the clothing and the beddings and things like that. So those are, I would say, like basic household precautions. And obviously, in public spaces, when that somebody, again, I hope people will not take this as shaming or hampering on people. But if you notice that somebody has a suspicious looking rash, or they are not feeling well, advise them to go home, leave where a lot of people are, or go to the hospital, or call a doctor and be like, hey, this person is not feeling well, they have a rash that looks suspicious, maybe take a picture of it, confirm, and things like that. If there's a testing center near you, send them there early, so that they can get away from large crowds quickly.
Is this disease treatable?
Not exactly. Viral illnesses generally on their own are self-limiting. So they will run their course and die out, right? When we were young, we had chickenpox. They would just let us wait it out. It will die out. But unfortunately, the problem is the spread in the process of waiting. And in some people, our DNAs are different. Some people, their body takes it on more. So it could cause things like a brain damage, encephalitis, cause inflammation in the brain, get into the eyes, cause vision problems, vision loss. So obviously, yes, you want to be able to shorten it. In some places, they have tried, in the extreme cases where someone is very ill, they've tried using certain medication that was created for smallpox, because they are similar, but it's not been fully approved for smallpox, for mpox. So there isn't any fully approved treatment for it, but off-label use, as they would say, of certain medications can be used.
All right, Dr. Kofoido, your final words, call to action as we wrap up now.
I would just say everyone should stay safe. Everybody has a responsibility to themselves, to their family, and to their community. People should not be selfish. Please, if you are not feeling well, avoid the public as much as possible. Wear a face mask, to cover your nose. Wear clothing at the very least. If you feel you have to go, wear clothing that covers up, so it reduces contact. If you are not feeling well, please reach out to a health professional ASAP. And everybody should please wash their hands as much as possible, as frequently as possible. And if you can wear a face mask, that would be awesome.
All right, you have the responsibility to protect yourself, your loved ones, and the community. Report symptoms early enough to the nearest health facility. Dr. Folake Kofoido, infectious disease expert, thank you so much for your time and expertise on monkeypox.
Thank you very much.
All right, yes, you're welcome. I have been speaking with Dr. Folake Kofoido, an infectious disease expert, on how to prevent monkeypox. What monkeypox is all about. Sound Health continues with trending health report from around the world. Please stay tuned. program has been Sound Health on Lagos Television, and we have been looking at monkeypox, also known as mpox. Recently, the World Health Organization declared it as a public health emergency of concern. So Dr. Folake Kofoido has explained or given us some tips, precautionary measures to embrace or to adopt to reduce the spread of this disease. Please report symptoms like rashes, we are experiencing uncommon rashes, fever, chills, headache. Report them to the nearest health facility. Protect yourself. You also need to wear the face mask. There is no treatment for this disease. There is no treatment for monkeypox. But for now, precautionary measures is the way to go. This is where we say thank you on today's episode of Sound Health. If you have topics you'd like us to treat or comments, please send SMS to 0035826603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.